The Moi Teaching and Referral Hospital is grappling with an overwhelming cancer burden, creating the need for government to address the rising cancer care challenges.
The Chandaria Cancer Center here at the Moi Teaching and Referral Hospital prides itself with equipment to cater for cancer patients. 6,000 patients report here every month, but out of that, only 600 get treated.
The executive officer of MTRH, Philip Kiro, says part of the challenge is late diagnosis, which leads to the facility being overwhelmed with patients at critical stages.
Unfortunately, in our society, majority of our patients are booked in advanced stage 3 and 4. And therefore, their 5-year survival at that stage is fairly reduced. And also the nature of treatment that our patients do require will be very aggressive treatment, unlike when you pick it in stage 1 and stage 2. So that is the purpose of advocacy, to pick this thing early enough. However, when you pick cancer in those advanced stages or even in the early stages, most of them you can still do surgery or various kinds of treatment like radiotherapy or chemotherapy, and you are likely to achieve cure.
February 4th was World Cancer Day. Doctors, patients, and survivors marched to create awareness. Dr. Kiro has warned against the reliance on unproven herbal remedies.
It's almost a cultural practice that when somebody gets diagnosed with cancer, they would not want to have surgery, they would not want to have any other modern day treatment. They would go back to try the various herbal medication. Unfortunately, even patients who are diagnosed slightly early, they will do the same. They will run away, go for herbal medication, and come in advanced stage. Again, you reach a stage where you're not going to do much intervention. You're probably going to postpone the inevitable, probably for a few months or years.
David Kioko, an oncologist here, says stigmatization takes center stage still for patients testing positive for cancer. Therefore, awareness will alleviate fears among Kenyans who perceive the disease as death sentence, he says.
You'll find these patients don't know who to approach. They'll just go to a hospital and state their problems. But if there's a connect in which all the caregivers will manage to be together and maneuver these patients on time, it will really improve the outcome of these patients and improve care. Many cancer patients don't report here for diagnostics, and some who report here come very late. Something Dr. Kiro says has posed difficulties in registering large numbers who recover from the disease. George Misati, Hubs Media, Eldoret.